So we're at 5 months, and this implant is still slightly mobile. I tapped it. And it didn't have that nice high-pitched tink sound that a well-integrated implant would. So I knew we needed to tighten it. It's not going to integrate further if we just wait. It's probably getting a little tongue and or food stimulation or micro movements. So we're going to go ahead and torque this back to 30 or 35 Newton centimeters. I know we're clear as far as vital structures above this implant, and we've got plenty of clearance from adjacent teeth, so this is going to be a safe procedure. We're going to remove the cover screw, which is just hand tight. That's okay, Bob. Just leave it for now. We're going to attach the 2.2 driver. Which just tightens like that. And now I'm going to go ahead and I'm going to set the torque wrench at 25 first to make sure we can get some torque without potentially spinning in what may be less than ideal bone. So we'll start at 25. I'm going to go ahead and place it on the driver. I'm going to do firm apical pressure, and I'm going to tighten. And there we got 25. That's great. I'm going to turn the torque wrench up to 30. Our depth is still good. That's 30, and we'll tighten all the way to 35. And we're at 35 Newton centimeters, meaning we got adequate torque. I'm going to disconnect the driver. I'm going to reinsert the healing screw, or the cover screw. Good, hand tight. And that is one of the differences between SDS and other implants. I have done a similar procedure with some titanium implants in the past, but as long as you don't have an infectious non-integration, this procedure works well. It compresses the bone, causes the local bleeding again, and short-term inflammation, which then allows for healing and integration. Every case that I have done like this, that I have been able to achieve a torque value of 25 to 35 on this kind of slow integration or potential non-integration at somewhere between 4 and 6 months. If I wait another 90 days, this has healed in every single case. The only cases it hasn't healed in is when this procedure doesn't work. We're either close to an anatomical structure, apically to the implant, or it starts to spin as opposed to increase in torque value. So something you need to know how to do if you're going to be doing ceramic implants.